You ready?
All right, yeah, I think I am, Dr. Ross. Okay, so I just saw Tajari. He's a 3-year-old male who's just here with his mother at the acute care clinic, and he presents with a limp for about 3 weeks now.
Okay, great. You want to tell me what you found out?
Yeah, sure. So like I said, he's a three-year-old healthy boy. Not much in his past medical history. He's been coming to Rush just for his normal checkups, and his immunizations are up to date. It seems like he's meeting all his milestones appropriately, like he's riding a tricycle, and then drawing triangles, able to have about 75% speech.
Okay, so that's helpful, but let's focus more on why he's here today instead of his developmental history.
Yeah, sure. Okay, you're right. So yeah, like I said, he's been here for a limp for about 3 weeks now, and Mom's been especially concerned for the last 2 weeks. It seems like it's kind of been getting a little worse. She first notices it when he kind of gets out of bed. And has started noticing more even at daycare after picking him up. Daycare has even called Mom and said that they've been noticing it too, more so at daycare. It seems like Mom as well as daycare is saying it's only on the left side. No one has ever witnessed any type of fall or any trauma or any type of injury. I mean, obviously he's like an active 3-year-old, but Mom is saying that definitely hasn't seen any injuries, but she does notice that he kind of drags his left foot more so at the ankle when he walks. He kind of points his foot a bit more outwards, and does definitely say that it hurts. So Mom's been giving some Tylenol to help, which has provided minimal relief. Mom hasn't noticed any swelling, no bruising, no discolorations, anything like that, and it doesn't really seem to bother him when he's sleeping or when he's sitting. It's more so kind of when he's moving. And it doesn't really seem to have any family history as well of Do
you want to focus on the family history when we get there?
Yeah, sure, my bad. I guess in terms of his other history, his past medical history, he did have some low vitamin D, but it seemed to be corrected about 2 years ago. And then, so for his family history now, Mom has had gestational diabetes, but doesn't have diabetes anymore. There's no history of any orthopedic problems in his family, or any orthopedic problems at a young age, especially. And he recently moved to Chicago from Milwaukee and lives with his older brother and his mom. And yeah, I mean, they kind of just do normal things that families like to do, like go to the zoo and things like that. But it doesn't seem like, nothing really striking or pertinent in social history.
Okay, so you mentioned that he's in daycare. That seems kind of pertinent since he's there for 7 or 8 hours a day.
Gotcha, yeah. You're right, yeah, that's true. But then, otherwise, he doesn't have any surgical history. And like I said earlier, he's meeting all his milestones developmentally, so otherwise doing well. So in terms of review systems, he hasn't had any headaches or no blurry vision or dizziness, no difficulty breathing or no chest pain or anything like that. He doesn't have any allergies, but he does have kind of this limp in his left ankle, and when he started and actually had it about 10 days ago, he did have some loose stools as well as one bout of emesis. But it kind of resolved after a little bit. He did have a fever at the time, but it was around 101 degrees, and he lost about one pound during that illness. And apparently, all the kids at daycare were having some kind of barbecue chicken, lunch. So it seems like it was something that kind of came about and has gone away. So, but it seems like all their review systems has been negative.
Okay, nice job. You did a good job of listing the pertinent negatives and then talking about the positives afterwards.
Perfect, cool. Thanks. So in terms of his the next part is objective. He's afebrile. His blood pressure is at around 98/68. He's breathing well at about 20 breaths per minute. He has a normal heart rate at 80 beats per minute. He's a little heavier. He's about the 95th percentile for weight, as well as 70th percentile for his length. And so on exam, overall he's very cooperative, active young male with a normal cephalic head. In terms of his HE&T exam, he has clear sclera, normal nares, tympanic membranes are bilaterally normal, no erythema. no oral lesions, and he has no lymphadenopathy. Cardiovascular exam, he's got normal rate and rhythm, normal S1 and S2. Doesn't seem like, I didn't hear any murmurs or gallops. And then he does have +2 normal radial pulses. And then his lungs were cleared auscultation bilaterally, no crackles or no wheezes. His abdomen is soft, non-tender, non-distended, with no hepatosplenomegaly. And then more specifically on his neuro exam, he did have a normal Romberg. He had normal detonant reflexes at the knees as well as the ankles. And then he does kind of seem to walk with a limp on his left side. But he does appear to have some normal tone as well as some normal sensation of palpation in those areas. And then specifically for his MSK exam, he doesn't seem to have any erythema or swelling at the joints, at any of the joints. He does have some decreased strength in the left leg. He has some good range of motion overall with his hips and knees, but it kind of seems like whenever I guess passively move his hip, that he has a lot more pain when I'm internally rotating it. But I didn't see any signs of trauma, no like excoriations, no deformities or broken skin at the area.
Okay, nice. That was a really good detailed exam. We did a good job of focusing on the neuro and the MSK portions of it, which are very pertinent to this. So in terms of his decreased strength, how did you assess it? What was he able to do or not able to do? For example, could he bear weight on it?
Yeah, so he definitely can bear weight on it. I guess I would say when he was on exam, he was having some difficulty lifting his leg against some resistance. So on the left, but the right was normal. So I'd say probably like I think that would be like about 4 to 5 strength on his left hip flexion.
Okay.
Yeah.
Do you want to give me your differential diagnosis for this limp, and then we'll talk about assessment and plan?
Yeah, so I was definitely trying to think of some differential diagnoses. I just I couldn't really think of a whole lot because I've never really worked with kids specifically with limps.
Yeah, definitely. It can be tough at first. So let's focus on the differential diagnosis for a limp in a toddler.
Sure, okay. Well, definitely, I guess, definitely not, wouldn't be like osteoporosis. You probably see it in like older people. I think, one thing on the history that was striking to me that I definitely can find a correlation potentially with was he did have like low vitamin D, and I know that can cause hypocalcemia, so that could potentially be a reason.
Right. So why don't we try breaking down the differential diagnosis into categories? So he could be coming in with a neuro problem, a bone problem, trauma, and again, focus on this in a 3-year-old. So probably not osteoporosis. You were right on that.
Yeah, you're right. Okay. Yeah, that helps. So let me think about this. So I guess first we can do like infectious. So he did have that history of those kind of gastric symptoms, like maybe a gastritis or gastroenteritis. So he could have some kind of lingering symptoms from that. So I know some things that can cause problems with, I guess, with more of the bones, or even muscles, could be like osteomyelitis, as well as like potentially some type of post-infectious synovitis. In terms of, I guess, another good system would be like orthopedics. So I definitely heard of like toddler's fractures. It doesn't seem like he has any type of trauma. It could be like non-accidental, maybe if the mom or anyone at daycare or something who's having any problems, but it didn't seem like that in history. Another thing could be like Osgood-Schlatter's disease, something I've heard about. I think that happens in some older people, or in some older kids, but it doesn't seem like he has any tenderness around that, like the tibial area, which I think is more common in those kids. Again, he could have like skiffy because he is pretty overweight, and mom had diabetes, but again, he kind of seems young for that. And then I guess another thing, like I know in the hip too, sometimes can happen like kids can have like avascular necrosis. I think in like sickle cell patients, so I guess maybe not for him.
So you're doing a really good job of thinking out loud, talking about your differential in each of the categories, and then explaining why or why not it would make sense in this case. Do you want to keep going?
Alright, sure. So we talked about infectious, we talked about orthopedics. Another thing could be, oh yeah, definitely like hem-onc or something like that. I know like a lot of kids with any type of joint or bone pain can definitely have higher or potentially have leukemia or lymphoma. Another thing could be, I know like ALL is pretty common at this age group, or is I guess the most common type of leukemia. I think like osteochondroma could be another potential. But again, it seems like his age is a little out of the picture for that.
Right. Yeah, and for
yeah.
ALL, we definitely don't want to miss cancer in a kid.
Yeah, no, definitely. That's totally true. And then I guess like one other thing we could talk about is some type of rheumatologic type thing. So something I know that comes to mind is like some type of like juvenile rheumatoid arthritis. I know that usually kind of has a different presentation with like maybe more joints, I think, but I guess maybe it has to start somewhere. So maybe one joint, maybe that could definitely be on the on the potential.
Sure, that's great. Do you want to give me your final assessment and plan for Tajari?
Yeah, sure. So so Tajari is a 3-year-old male. Doesn't really, with no significant past medical history, and he's presenting today with a 2-week history of a limb. His differential is a little broad, like we kind of talked about for his age range, but we mainly talked about orthopedic problems, trauma, infectious disease, hem-onc, as well as even some type of rheumatologic process. Even because it's broad, I guess I'd like to do a few different tests. Maybe we could test for some inflammatory markers, and like CRP, ESR, those are some good inflammatory markers to check. And then CBC, and potentially even a blood culture that can help kind of differentiate a leukemia picture, or maybe even some type of like sepsis or like infective process. And then I think an X-ray would definitely be smart too, because in this kid with kind of this recurring joint pain, it just makes sense to take a quick look at the hip and see what could be going on in that area.
Totally.
Yeah.
Are you going to do anything for his pain?
Yeah, that's a good question. Actually, he's in pain. So, I mean, I don't know, for kids his age, maybe like Tylenol, ibuprofen, or something like that. Does that
Sure. So we could give him ibuprofen.
Okay.
Definitely. And how are you going to follow up? Does he need to be admitted?
He didn't seem like he needed to. I think just kind of based on his clinical picture, he was pretty well appearing. Didn't seem like he was in any acute distress. So I think he should be good to go. But I mean, definitely we should follow up with them and make sure that the family's aware of. I guess if we do end up doing some of these labs and stuff, just to make sure the parents know what's going on and what kind of results are. So
For sure.
Yeah.
You want to go see him?
Yeah, let's do it.